Congratulations on your Midmark mobile dental delivery system. In this video, we'll show you how to properly unbox your system and set it up. First, do not attempt to move the Midmark mobile delivery system while it's on the pallet. It weighs over 150 pounds. Attempting to move or slide the pallet could damage floors or cause injury. Once ready to open the box and get started, place the pallet in an area where you will have room to comfortably unbox the system. The first step in unpacking your Midmark mobile dental delivery system is to carefully cut the outer strapping and lift the cardboard cover up and off the dental unit. Next, remove the cardboard sides by cutting the tape that secures it in place, and remove each side. On the top of the unit, remove the large flat brown box marked Accessories. Set the brown box aside in a safe location until later, when the accessories are set up. Remove the plastic covering on the unit. Once the packaging has been removed, you will find an envelope and black mat. Remove the plastic cover from the mat and place on top of the unit. The envelope contains the quick reference guide, two sample client-facing brochures, user guide, setup manual, and the biofilm problem flyer. Store this envelope in a safe, dry place where it can be easily found when needed. Next, remove the packaging from the air-water syringe and place the syringe in the holder labeled Air-Water. Remove the packaging from the foot pedal and drape the pedal over the back handle and set on the shelf. Then remove the plastic cover from the pedal. At this point, you will need a second person to help you lift the Midmark mobile dental delivery system from the pallet. Carefully lift it straight up and securely place all four wheels on the floor. Now let's focus on the back of your Midmark mobile dental delivery system. First, remove the power cord from the accessory box you set aside. Plug the power cord into the back of the unit. The cord is designed to be loose in the outlet in the event the power needs to be cut quickly. To the left of the power outlet is the on and off switch. When setup is complete, the switch can be flipped up to power the unit on and down to power it off. Between the power switch and power outlet are the two breakers for the dental unit. If either breaker trips, it will flip down and show as white. A breaker may flip when there are too many pieces of equipment running on the same circuit. To reset the breaker, flip the switch back up. The door handle can be used to store the power cord and foot pedal when the system is not in use. Also on the back of the unit are the air oil separator, the air tank exhaust hose, and the air tank exhaust valve used to drain pressure from the air tank at the end of the day. Next, locate and remove the two water bottles from the accessory box, which have a quick connect and disconnect attachment installed for easy on-off applications. To insert the water bottles onto the back of the unit, gently gather together the water pickup tube and water level sensor and insert into each bottle. Line up the quick connect with the metal pin. Apply upward pressure and turn counterclockwise to lock the bottle into place. Turn the quick connect clockwise, then pull down to remove the water bottle. The toggle switch between the water bottles controls which bottle supplies the water. When the toggle is in the center position, it is in the neutral position. Move the toggle to the left to use the left bottle, and move the toggle to the right to use the right bottle. Flipping the toggle to the pressurized side or the middle neutral position allows you to remove and refill the bottle during a procedure without interruption or losing the stored air. Please note that shocking your water lines is required for first use to eliminate microbes that may have developed from remnant water left from the factory testing. Details for waterline shocking and maintenance can be found in the Dental Delivery System Setup Manual or in the instructions for use that come with the VistaTab Dental Waterline Cleaner tablets that may be included with your unit. Moving to the back door, you will find access to the air pressure tank and main air regulator, with a button that can be pressed for draining at the end of the day. Additionally, you can twist off the regulator cover to access the regulator filter for maintenance. Under the black mat on top of the delivery system, you will find a quick reference label that explains unit and handpiece maintenance, a scalar tip wear guide, and a QR code for additional resources. To access the inside of the unit from the top, locate the lever on the underside of the top end of the unit. Pull the lever toward the back of the unit to release the lid, and then lift the lid. Inside, you will find the air pressure regulator, which is factory set down to 65 psi, the max setting for proper handpiece activation. Also under the lid, you will find the drive air adjustment knobs. These knobs are used to adjust the PSI to each handpiece and should be factory preset. To adjust to the recommended PSI set by the handpiece manufacturer's user's guide, watch the pressure dial on the front of the unit while using a small flathead screwdriver to slowly turn the knob counterclockwise to increase air output and clockwise to decrease air output. There is a push-button dimmer switch to adjust the brightness of the water level indicator with 3 levels of brightness and an off position. Next, to close the lid, place your fingers on the overhanging edges on the sides of the lid and press firmly down until the lid clicks into place. On the side of the Midmark dental delivery system is a convenient storage drawer with 2 removable tubs to hold items such as prophy angles, burrs, scalar tips, conditioning spray, and other items to keep close at hand during procedures or routine maintenance. The 2 tubs can be removed for cleaning or set on top of the dental delivery system for easier access during procedures. There are 4 handles conveniently integrated into the top front sides and rear back sides of the unit to pull or push the unit safely. When moving the unit over a large threshold, use the rear side handles to carefully pull the delivery system up and over onto a level surface. Lastly, the unit has 4 locking casters at the bottom of the unit. Push down on the on lever to secure the casters in place, and push down on the off lever to release the casters. Now we will go over the front of your Midmark mobile dental delivery system. The faceplate is labeled to indicate the position of each handpiece. The black and white knobs are the water controls for the handpieces and correspond to each from left to right. Turning them counterclockwise will increase water output, and clockwise will decrease water output. In the middle of the faceplate is the handpiece pressure gauge. This will be used when adjusting to the proper air pressure for the handpieces. Above the scalar icon is the multicolor scalar intensity dial. This is used to set the correct range of frequency for your scalar, depending on which tip you are using. We will come back to this later in the tutorial. In the center of the faceplate, the water level light illuminates the level of water in each bottle. A blue light means there is sufficient supply of water. As the water level decreases to the last 25%, the indicator light will switch to red to show that it is time to refill the corresponding bottle. Now it's time to review the accessories that you safely set aside earlier. Open the flat brown box. Inside, you will find the remaining accessories: high-speed handpiece and low-speed handpiece, swivel coupler and conditioning nozzle on available models, an Action box with the Piezo scaler and accessories, a bubble-lined envelope with a burr block and starter pack of assorted one-time use carbide burrs, a diamond burr, plus an informational insert, disposable Profi angles, a brown box with handpiece conditioning spray, and a package of 3 straws for the low-speed and non-swivel handpieces, and a package of VistaTab Dental Waterline cleaner tablets. You will use the spray bottle and red straw to condition your high-speed fixed back and low-speed handpieces, and the conditioning nozzle for your swivel high-speed handpiece. Moving on to the handpieces, we'll start with the high-speed with swivel. Inside this box are the handpiece, blank burr, and instructions for use. Also, you will find a chuck conditioning nozzle, diffuser wrench, and the quad port spray cleaning tool. The swivel nozzle used for conditioning swivel handpieces will be in the brown accessory box. We will go through how to use these tools later, but it is important to keep them all stored in the handpiece box so you do not lose them. Next, we'll open the high-speed swivel coupler box. Included in this box are the swivel coupler wrench, replacement O-rings, and instructions for use. If you have purchased a fixed back high-speed handpiece rather than the swivel, the box will consist of the complete handpiece, blank burr, push-button chuck spray nozzle, and diffuser wrench, quad port spray cleaning tool, O-rings, and instructions for use. In the low-speed handpiece box, you will find the low-speed handpiece and its instructions for use. Keep the box in a safe place. The flat white box includes the largest number of accessories. Inside, you will find the Piezo scaler handpiece, autoclavable plastic storage box, 3 scaler tip wrenches, 3 scaler tips, and scaler tip wear guide, and instructions for use. Save this box and keep it in a safe place to store your extra accessories and scaler tip guide. Note that the scaler tip guide can also fit flat inside the storage drawer. Now we will cover what is in the smaller boxes. The 3 small cube boxes hold the scaler wrenches. You can put them in the autoclavable storage box. The thin Action box holds your scaler, instructions for use, and an O-ring replacement kit. In the small white box are the 3 scaler tips and the scaler tip wear guide. Next, let's discuss the foot pedal. Set the pedal on the floor in front of the unit to use it. A handpiece is activated once it is removed from its holder. To activate the handpiece properly, you must press the foot pedal all the way down. Without adequate pressure on the foot pedal, the handpiece may not operate at the proper RPM range. Before the first time use of your Midmark mobile delivery unit, it is important to shock the water lines. In this demonstration, we will use the included VistaTab Dental Waterline cleaner tablets to shock your system. Fill both bottles with distilled water up to the maximum fill line. Remove 4 tablets from the maintenance kit and place 2 tablets in bottle number 1 and 2 tablets in bottle number 2. Once the tablets have dissolved, install the water bottles by threading the water sensor and water tube through the quick connect and into the bottle. Then push up and twist counterclockwise until the bottle is in position. Repeat this step with the second bottle, then toggle the bottle switch toward bottle number 1. Be sure to plug your mobile delivery system into an outlet. Next, turn each water knob counterclockwise to the fully open position so that water can easily flow through each handpiece tubing, and then turn on the power button. For best flow, remove each handpiece tubing separately and hold it over a bucket. Step on the foot pedal and allow the treated water to flow through the tubing. Repeat this for each handpiece and the air water syringe until 2/3 of the treated water has flowed through. Then let the remaining 1/3 of water sit in the bottle for 5 minutes. Switch the bottle toggle to number 2 and repeat the process of running water through each handpiece line and syringe. Then let the remaining 1/3 of water sit in the bottle for 5 minutes. After the treated water has been in the lines for 5 minutes, flush all of the remaining water by picking up all handpiece lines and holding them over a bucket. Press the foot pedal and run until the water in the bottle is empty. Repeat with the second bottle, letting the water flow through the air water syringe until empty. Then turn the power off to the unit. Remove both bottles and rinse them out. Then refill with at least 500 milliliters of distilled water and reinstall them. The last step in the Waterline shock treatment is to remove any residual chemicals from the lines before use. Start by turning on the power to the unit. Starting with bottle 1, remove all handpiece lines and hold over a bucket. Press on the pedal and flush at least 500 milliliters of water through them. Switching to bottle 2, pick up the air water syringe and flush at least 500 milliliters of water through the syringe. Refill the water bottles with distilled water as needed. Now that you have completed your initial Waterline shock treatment, we will show you how to set up each handpiece, starting with the high-speed handpiece. To attach the high-speed handpiece to the unit, you will first need the swivel adapter and the swivel adapter wrench. Insert the swivel adapter into the coupler, ensuring it is going into the correct holes. Grasp the long end of the swivel adapter and hand tighten the coupler. Use the wrench to tighten the adapter until snug. Do not over-tighten the coupler. The swivel adapter should not be flush with the coupler. Insert the end of the swivel adapter into the open end of the high-speed handpiece and push until it clicks into place. Once it is attached, insert the blank burr. To properly seat a burr, insert it into the chuck until it stops. Center your finger on the button. Press, then push the burr until it is fully seated in the chuck. Tug back on the burr to ensure it is properly seated. Lift the high-speed handpiece from the holder. Turn the water off and press down on the foot pedal to verify the PSI is set between 32 and 40. Adjust as needed by using the drive air adjustment knobs located under the lid. Adjust the water to a fine mist using the corresponding water knob. To avoid damage to the turbine, never run a high-speed handpiece without a burr. Next, to attach the low-speed handpiece to the unit, first ensure the aligned water knob is off. insert the low-speed handpiece into the correct size holes. Tighten the coupler to the handpiece, but do not over-tighten, as the handpiece and coupler should not be flush. Next, turn the locking ring counterclockwise to unlock. Then install the profi angle to the handpiece. Turn the locking ring clockwise to lock it in place. Lastly, lift the low-speed handpiece from the holder and press down on the foot pedal to verify the PSI is set between 35 and 50. Adjust PSI as needed. To connect the piezo scaler, line up the dot on the handpiece with the dot that is on the line on the coupler. Push until the handpiece is fully seated on the line. Do not twist the handpiece once it is fully seated on the line. Twisting the handpiece could break internal components. To attach a tip to your scaler, you will need a scaler wrench. There will be one wrench for each provided scaler tip. You will notice a colored band on the scaler tip. Make sure the scaler power setting on the dental unit is set to the same color. The included scaler tips always run in the blue section of the power dial. It is recommended to set it to 6, which is the lowest frequency in the color range. Load all the tips into the wrenches and leave them accessible on the work surface. Use the guide on the side of the wrench to insert the tip into the wrench. Screw the tip into the scaler clockwise until the gray center of the wrench can no longer turn. Once the wrench stops turning, apply additional force until the blue outer ring of the wrench continues to turn to fully seat the scaler tip into the scaler. Your scaler tip is now fully tightened. To avoid overheating of the scaler tip and achieve desired cavitation, it is important to have proper water flow during use. Lastly, to ensure the scaler is set to the correct water setting, turn the water and power all the way down. Step on the pedal, turn the water up until it is a fast drip. Then turn the power dial to the desired setting in the blue section. This should produce a nice halo. Adjust as needed. One of the most common ways to damage your piezo scaler is to have it catch on clothing, pull off the holder, and fall to the floor. The autoclavable storage box has a built-in section made for the scaler. Between procedures or at the end of the day, take the scaler off the unit and place it in this section to avoid damage. Between each procedure, clean and condition your handpieces. For sterilization of handpieces, always follow the manufacturer's instructions for use. The air and water syringe comes assembled on the unit. To use the air-water syringe, lift it from the holder. For water, press the left button. For air, press the right button. For a mist, press both buttons together. Now we will go over how to condition your handpieces. Use the blank burr to condition your high-speed handpiece for the first time. To condition the handpiece, attach the swivel nozzle to a well-shaken can of conditioner. Push the conditioner nozzle into the open end of the handpiece until it clicks. Hold the handpiece over a towel and depress the conditioner spray for a few seconds, or until lubricant is present at the end of the burr. Next, remove the blank burr by lightly pulling outward on the burr. Center your thumb on the push button and apply inward pressure. Set the blank burr to the side for a moment. Now attach the chuck conditioner nozzle to the can of conditioner. Insert the tip of the conditioner nozzle into the chuck of the handpiece until it is fully seated. Hold the head of the handpiece over a towel, Then depress the can of conditioner for a few seconds, or until the conditioner comes out of the head cap. Wipe down the handpiece and head cap with a towel. Insert the coupler onto the handpiece connector and tighten using the coupler wrench. Then, attach the handpiece to the coupler. When your high-speed handpiece is reconnected, turn the aligned water knob off and depress the foot pedal for 45 seconds to expel any excess conditioner. Once completed, adjust the water until it becomes a fine mist. If you have purchased a high-speed handpiece without a swivel, instead of using the swivel nozzle on the can of conditioning spray, you will use one of the red straws inserted into the smaller of the two large holes at the end of the handpiece. Hold the handpiece over a towel and depress the conditioner spray for a few seconds, or until lubricant is present at the end of the burr. Next, remove the blank burr by lightly pulling outward on the burr. Center your thumb on the push button and apply inward pressure. Set the blank burr to the side for a moment. Now attach the chuck conditioner nozzle to the can of conditioner. Insert the tip of the conditioner nozzle into the chuck of the handpiece until it is fully seated. Hold the head of the handpiece over a towel, then depress the can of conditioner for a few seconds, or until the conditioner comes out of the head cap. When your high-speed handpiece is reconnected, insert the blank burr, turn the water knob off, and depress the foot pedal for 45 seconds to expel any excess conditioner. Once completed, adjust the water until it becomes a fine mist. After the first conditioning of the high-speed handpiece, it is no longer required to insert a burr during the conditioning process until you reach the final step of reconnecting the handpiece. Your low-speed handpiece should be conditioned daily to prevent diminished performance. To condition your low-speed handpiece, insert the red straw into the can of well-shaken conditioning spray. Insert the red straw into the smaller of the two holes until it is fully seated. Hold the handpiece over a towel and depress the can of conditioner for a few seconds, or until the conditioner comes out at the end of the handpiece. Wipe down the handpiece with a towel. When your low-speed handpiece is reconnected, ensure the water knob is off. Depress the foot pedal for approximately 45 seconds to expel excess conditioner. Your Midmark mobile dental delivery system is now completely unpackaged and ready for use. Be careful throwing away packaging from your new dental unit. Double check to make sure you aren't throwing away parts, accessories, or user documents. Keep all accessory packaging for storage of extra parts, user guides, and other documentation for reference. If you have any questions, reference the included Midmark Mobile Dental Delivery User Guide or call Midmark Technical Support at 1-800-MIDMARK. The next step in practicing dentistry at the highest level in your clinic is whole team training. Visit midmark.com/animal-health and go to Midmark Academy Training for more details on over 80 hours of RACE-approved clinical training, including a 2-day in-clinic best practices workshop. Or contact Midmark Academy at midmarkacademy@midmark.com for more information.